Hello, everyone, and welcome to Functional Medicine with me, Dr. Howard Robbins. Uh, very shortly, we're going to be doing my podcast, Functional Medicine with me, Dr. Howard Robbins. Today's show is on Prolozone Therapy. It's a miracle medicine in that it can save you from having to have shoulder, knee, hip, back, foot surgeries. It basically can repair joints that are bone on bone. Won't, as you're going to learn more about it when we begin the show in just a few minutes. So I'd just like to thank everybody for listening to this. And this is actually appearing now on our new YouTube website, channel, I guess, whatever they call it, on YouTube. And we're going to be publishing this there as soon as this show is over, so people can see me as well as hear me. On Voice America, one of the wonderful things about it is all the shows are archived, so people can get it literally around the world. We're heard in over 70 countries now, which is kind of cool. And every given week, we'll have as many as 30 countries, and sometimes we even come up with countries I never heard of. We have a very large listening audience. Since I don't do shows that just talk about what's the latest that week in healthcare, it isn't like listening to a news show. Each of our shows are very specific. It allows people to get a lot of useful, almost timeless information. And I'm repeating a lot of the shows that are the most commonly listened to shows. So now you can actually see me and get this live, so to speak. Okay. You'll see me scratch my head or whatever. Okay. I'm just sort of tuning things up and warming you up because very shortly I will be contacted by Voice America and we'll get everything going with them. Soon I'll have a new background here. Doctor's Biome is one of my sponsors. It's very important in Prolozone Therapy in the sense that it helps repair your gut, and you're going to learn about that in the show, so that your body can produce what's called stem cells. And that's what actually does the repair. It's the stem cells that do all the work. So when they come on, which will be any minute now, you'll hear me stop talking and talking to them. You may not hear them asking me questions and testing the sound levels and everything. Then the show will begin. And here we go. Okay, everybody, stay with us. You won't be sorry. Prolozone therapy is absolutely amazing. I do a lot of it now, and I get blown away by the results. The patients are just amazingly happy. And I'm a recipient as much as I am a giver of the therapy, as you're going to learn about how I get it in the show, how I get it. I help my buddy train doctors in it. And we'll begin, I'm sure, any minute now. You should get a pen and paper ready. That's very important. Have a pen and paper ready so you can make notes and know how to contact us, how to find out about doctors who have been trained in it, maybe so you don't have to travel. If you live elsewhere around the world, it's going to be a little difficult. Because it isn't commonly done all over the world. People have to have gotten the training. And welcome once again to Functional Medicine with me, Dr. Howard Robbins. As you know, our show is dedicated to giving you safe and effective ways of treating medical problems that might require, maybe never could be helped, or might require surgeries and other or serious pharmaceutical medications that come with risk and are less safe. Today, we're going to be talking about Prolozone Therapy and saving shoulder, back, hip, knee, ankle, foot surgery, how to repair muscles and tendons. I mean, it's just an amazing tool that we use now as and I'm a recipient of it. I want to let everybody know that we're putting together a YouTube channel for all my podcasts here on Voice America, so you can see me as well as hear me. In any case, so let's first start with thanking my sponsors, as I should, because that's why I'm here. They pay for the show. The first sponsor is Promolife, Promolife, promolife.com. Very important company to people with muscle, tendon, knee, ligaments, and surgeries, because medical problems of all kinds, heart problems. Why? Because you can do home care ozone. Prolozone therapy, you're going to learn, is in injections that are done in doctors' offices. But home care ozone, particularly the not intravenous methods, which you wouldn't be doing yourself at home, God forbid, but you would be doing rectal insufflation. Now, rectal insufflation is basically an ozone enema that you can absorb some of the gas into your blood, and that will stimulate natural stem cells to be made in your body. And you're going to learn from the show how stem cells actually do the repair. I'm going to be speaking next week from the date of this show to the American Academy of Stem Cell Physicians. And we're going to be talking about how ozone, intravenous ozone, prolozone, and microbiome, probiotics, help in the repair of all these joint injuries and problems. And how the miracle of it, actually. So you can contact Promolife, Promolife.com. You can call them at 888-742-3404. That's 888-742-3404. And tell them you heard about it here on the Dr. Robbins Show. They'll be very happy to give you a discount or something special, depending on what you're purchasing. So you tell them you want to get set up for home care. They know the kind of materials you need to be able to do home care ozone therapy. And we've done radio shows, or podcasts, I guess we should call them these days. We've done podcasts here on Voice America discussing home care ozone therapy. So you can go back and listen to them, and they'll explain how to do it and whatnot. Very valuable tool to have at home in the prevention and treatment of many various diseases and conditions. Next, you can go to doctorsbiome.com, doctorsbiome.com. Okay. Doctor's Biome is a very special probiotic beverage. It has 15 patented strains of probiotics that are created to survive the stomach over 90%. I know you're already taking capsule, powder, or tablet probiotics. They are destroyed over 90% in the stomach. Then they have to be what they call smart probiotics. Okay, smart probiotics. Smart probiotics are actually created to stick to the wall of your gut. Not all bacteria, not all probiotics are made in such a way to do that. And that's what you need. That's where you do the repair of the gut. And by having a healthy gut, virtually you affect all disease in the body. Okay. And you can help with all medical problems throughout the body. Believe it or not, the gut is connected to everything. You can listen to our shows on it. but it's very important to manufacture stem cells in your gut. And these mesenchymal, these stem cells in your gut, help in repair of these damaged body parts. So you go to doctorsbiome.com, doctorsbiome.com, and you put in the code radio20, and you'll get 20% off, I believe, your first order. Radio 20. After that, you can go on auto ship and get 10% off all future orders. I promise you won't be sorry, because it comes with a 100% money back guarantee. And it's delicious. All the living patented strains are living in a 100% organic mint, kale, lettuce, cucumber, celery, apple, lemon juice. So it's absolutely delicious. Children love it. And everybody virtually needs it. So remember to go to doctorsbiome.com, put the code and check out Radio 20. You'll get 20% off your order. And I promise you won't be sorry. So let's talk about what we're talking about today, Prolozone Therapy. So what is Prolozone Therapy? And for those of you that are able to watch this, okay, I'm going to be putting up on the screen, okay, my presentation that I'm going to be making, and this is what this talk is going to work off of. So our show today, next week, I'll be speaking about this at the American Academy of Stem Cell Physicians. And one of the things, people go, I never heard of this. I once had the privilege and honor of interviewing Dr. Linus Pauling, twice a Nobel Prize winner. And when I did interview him, there's a quote that he said that I use all the time when I lecture. Whenever your colleagues are up on something, you usually find they're down on it. So people go, well, I guess I should ask my doctor about it, my orthopedic surgeon about it. Will it help my shoulder, my back, my hip, my knee, bone on bone, perhaps in a joint? Well, they don't know anything about it. The only answers they can give is, gee, I don't know. And that would be honest. Most of the doctors are ashamed to say they don't know anything about it, because they don't have a deep academic knowledge or a deep clinical experience with something. So some of them may say, oh, no, it sounds dangerous to me. Others may say, oh, yeah, why not try it? What have you got to lose? Both are unfair and incorrect, because if you don't know about something, you shouldn't be recommending it or poo-pooing it. So, I've been doing intravenous ozone therapy for over 33 years. By the end of this month, we'll have done, at the time of this show, over 413,000 intravenous therapies. That's more than any one clinic in the world, and more than all the doctors in North America and probably Central America collectively put together. No one has our clinical experience as far as we can tell. And ozone, this is very important, because that's what Prolozone therapy is all about. Ozone is actually created in your body, okay? It's actually generated by immune cells called neutrophils in your body. So it's actually a natural substance that your body produces. And the Scripps Research Institute found that out back in 2003. And of course, ozone can be used to treat many, many, many different medical problems. That's the intravenous benefits of it. It can treat all sorts of diseases and conditions that won't kill you, but will make you wish you were dead, like herpes and diabetes and whatnot. But it also treats infectious diseases and diseases that can kill you very effectively. When we're dealing with this, remember, oxygen is the source of all energy. Oxygen does many, many, many different things. And one of the many benefits of the main method of doing this is natural stem cell activity is increased in your body. And as you're going to learn, stem cells can do what I call repair the unrepairable and fix the unfixable. And that's why we're so successful in helping so many people. If Prolozone therapy fails, well, what do you have left? Live with whatever you're left with in terms of pain and dysfunction, or have surgery if surgery can be done safely. The problem with surgery is that it doesn't, there's no guarantees. And it comes very often with adverse effects or side effects that you're not particularly happy about. When surgery is successful, boy, it's a wonderful thing. But the stimulation of natural stem cells to be made in larger amounts comes from the intravenous methods of ozone therapy predominantly. And there are virtually no adverse effects from it. And that's one of the most wonderful things about it. For those of you that are watching this on YouTube, I'm scrolling through what the people around the world aren't seeing on Voice America, my PowerPoint presentation to the American Academy. I'm going to be getting to the important parts of this for everybody very, very shortly. So ozone can clean the body out of harmful free radicals and negative things. And very important, and you heard me talk about this when I talked about our sponsors, for any kind of ozone therapy, you want to be well hydrated. If you're repairing a joint, the human body is, or a muscle tendon or ligament or disc injury or problem, keep in mind that the human body is 70% water. So you have to have healthy water in your body and enough of it to hydrate all your tissues so that they can be healthy. And since it's oxygen and water are two basic elements that we need to grow old and be well, to stay healthy, it's essential that you be well hydrated if you want to repair any part of your body. Now, vitamin C is very important also in repair. Why? Vitamin C is not just a vitamin. Vitamin C is a coenzyme. It helps with every cell of your body that's healthy do all its cellular processes. It mediates these cellular processes. So the repair process is so important that you want to make sure you have enough vitamin C, because remember, you're going to take it orally, and within 2 hours you've used what, if you got a good quality one and you absorbed it, it was bioabsorbable, then it was bioavailable to your cells and bioutilizable by the cells. That's why you need high quality vitamin C, okay, like a high quality liposomal vitamin C, whatever. Bottom of it all is you need it to help in the repair. Those that don't have enough of it don't repair as well or as fast. So we recommend that you take it 5 or 6 times a day. And then, of course, you have to replenish the gut with healthy probiotics, as I explained earlier, and that's where Doctor's Biome comes in. And I'm published in medical journals, peer-reviewed medical journals, showing the benefits of probiotics, the benefits of ozone therapy on various viruses and other medical problems. But ozone also kills good boys like antibiotics do, and that's why most people don't have a healthy gut and don't produce enough stem cells. Anybody that's had an antibiotic even once in your lifetime, okay, even once in your lifetime, you have killed off all the good boys. If you eat red meat or chicken that isn't organic or farm-raised fish, I don't care if you burn the meat, you're going to get some antibiotics eventually, because they don't like to kill the animals. They'll feed them antibiotics to make them healthy again so they could sell it to you. And that kills the good boys off. All right. So, and most probiotics, capsule powders, and tablets don't work. Um, Eliav and Segal found that out from Israel's Weizmann Institute when they did their famous study showing how all these probiotics in capsule form sometimes don't even open up, and they just float through your system and out the other way. They measured the amount going in and the amount going out, and they found out most of them came in asleep in suspended animation and came out dead, and with capsules that were maybe partially or not completely open. Um, so Doctor's Biome was created that overcomes all these health issues. And thus, you can create a healthy colon again, and thus produce what's called MSCs, mesenchymal stem cells. And it's the mesenchymal stem cells that help favor the regeneration of organs around your body, and um, and in many other processes. I have a gentleman whose heart was damaged, and just with intravenous ozone, parts of his heart that were permanently damaged were shown to be able to be repaired and put back to health again with intravenous ozone therapy. Um, I don't know if we'll be able to play that for you, but here's what we're going to do. Let's go to our first commercial break. When we come back, I'm going to see if we can do something special, and I'll allow you to listen to one of my patients and one of the results that he achieved with some heart problems. And it was basically stem cells that did the repair. Everybody stay with us, and we'll be right back. I'm going to be doing something interesting since the way this works. I'm going to put my headphones when I try to play these videos that I have on some of my patients, and they're going to tell their story on how ozone therapy stimulated prolozone, so to speak, to work. Now, prolozone is injections into the muscle, tendon, ligament, or joint, but it's stem cells in general that do the work, not the ozone itself, as you're going to learn when I get into more detail about it. So you stay here with the show. When we come back, I don't want to talk about it now and then the rest of the listening world can't hear it. That's where Voice America is just so wonderful a station. I've been on it now for several years, very happy to be. And we're going to be talking with the gentleman that you hopefully see on your screen in the screen share, uh, uh, Peter. And Peter will explain to you what's going on. I'm going to see if I can't make this an even better screen share by. Hello, everybody. We're back again. And now I'm going to see if I can play you Peter's story so you could hear what he had to say. Something to relate to us, and it's okay if I film you, right?
Sure.
Okay, so why don't you tell us what went on?
Okay. 3 months ago, I had a heart attack. Hospital said that the bottom wall, the inferior wall of the heart, was beyond repair. It couldn't be restored. It wasn't working. And now, the other day, I just had an ultrasound, and it showed that that wall was working fully. It was restored back.
That's what else?
And then when I left the hospital, my ejection rate for blood from my heart was 49%, and now it's 63%.
How old are you now?
I'm 74.
Wow. Thank you.
Sure.
So hopefully you all heard that. In case you didn't, let me go over. So Peter had a heart attack, and the bottom wall of his heart was, he was told, permanently damaged. It would never be repaired. And obviously he had a serious problem. And what happened with Peter was about he was coming for other reasons. And okay, so unfortunately, I found out you all didn't hear that, so I'm just going to tell you. I'm going to tell you what these videos are supposed to be saying to you. So his heart was, pumps out a certain amount of blood with each pump, and it was pumping out a very small amount. And pretty serious thing for a man in his mid 70s. Now he's in his 80s and still comes in regularly for ozone therapy. Well, in any case, within 3 months, he went back for a checkup and he found out that the bottom part of his heart, which was permanently damaged, was working fully again. And his heart was pumping out over 30% more blood with each pump. Okay. So, what an amazing thing. What an amazing thing that this occurred. Um, and the reason it occurred is because stem cells did the work. Ozone's in your body and gone 10 minutes. It's in a joint, muscle, tendon, or ligament, 10 minutes. And it's gone. And it's just literally gone. So how could it do all that work over time? Well, the answer is it stimulated natural stem cells to go into the areas of around your body intravenously, and hopefully in this case they found where they needed to go. Now the next one was a patient who had lost all her hair, and within 5 months her hair started to grow back, and within 7 months she had a full head of hair again. And that was caused by a stress-induced alopecia. Now, we never obviously injected her head to make her head grow hair. So it was intravenous ozone that stimulated natural stem cells and opened up the circulation to allow nutrients and oxygen to get in. And this is how her hair grew back fully. Then the next one, which I'm not going to try to play for you because one of the things is I don't know how to get the sound to come up so that everyone will hear it easily. It's only coming through my headphones when I turn it on. We'll try. I'm the opposite of a techie. Unfortunately, I am the exact opposite of a techie, and I will be getting patients and friends who are techies to help me get all these kinds of things set up so that we can give them, I guess, a more professional show. So here we have a young man who is in his mid-20s and he has autism. And it's very well known that an unhealthy colon can cause, trigger or lead to autism, and that a healthy colon can help improve autism. Well, ozone therapy goes into the brain, cleans out what I believe to be one of the main causes of it, as do many of the parents, in fact, all the parents of autistic children, and that's toxic metals in the brain. And by removing the toxic metals from the brain tissue, I believe it's stem cells that can actually repair the brain tissue and allow the person to become more functional again. Now, is it these mesenchymal stem cells? We don't really know. All right. But we do know that studies have been done around the world discussing how local injections of ozone, what we call prolozone therapy, can work. Now, what is prolozone therapy? Well, first of all, we first use a little local anesthesia in most of the prolozone therapy. We use local anesthesia with a touch of a special vitamin B12, methylcobalamin or hydroxycobalamin, and which helps in any nerve pain, nerve inflammation. And at first, we inject that when we we disattach that syringe because that's in a liquid form, and then we push in the oxygen and ozone gas at a very special concentration. And it's been shown that by doing that, we stimulate natural stem cell activity. Now, this causes the stem cells, I call it like a bugle call, to be drawn into that area. Now, prolozone therapy can do the work all by itself. On the other side of the coin, intravenous ozone therapy, direct IV intravenous ozone therapy, not the blood methods of ozone, we believe stimulates natural stem cell activity, though hyperbaric high dose ozone, HBO3, may do it as well. Stimulates natural stem cell activity, and then prolozone says, hey, this is where we want you to go. So what's actually happening? Well, when you have an injured muscle, tendon, ligament, joint, or disc, there's inflammation. And the inflammation causes swelling and pain. Well, ozone reduces the swelling because it acts as an anti-inflammatory and reduces the pain. By reducing the inflammation, it can help in a temporary way. So how do we regrow cartilage? It's there for 10 minutes and it's gone. And we've taken patients with bone on bone in hips and knees and ankles and had new cartilage grow. Well, it's the prolozone that does it. Okay. You can inject, it's the stem cells that it's calling into that area that are creating new cartilage, and healing the tendons and ligaments that are damaged, whether they be in the joint or around the joint. Muscle, for example, muscle injuries, same thing. It's the stem cells, because ozone's gone in 10 minutes. So what else can it be? Now, there are studies that have compared the use of prednisone for these joint pains, cortisones, prednisones, local injections versus the ozone. And while the prednisones and the cortisones, the corticosteroid injections, may improve pain and disability for a short period of time, eventually leading to surgery, it's prolozone that does the job. Now, prolozone is done in terms of eliminating the problem. It's done only once a week. You can push the envelope a little bit. You might do it once every 5 days. But then, generally speaking, it's done on a once a week injection. And all the studies have shown, when they try to compare the two, steroid injections versus this, steroids come with a host of side effects and adverse reactions. They can adversely affect every organ and every system in your body. It's one of the most dangerous medicines, though it can be beneficially used, one of the most dangerous medicines ever created by man. I never use it in my practice, ever. Okay, it's as simple as that. I don't. I know there are many doctors who may be listening to this show, and you're more than welcome to do anything you want. To me, if you need prednisone, you may as well have surgery, if surgery can be done safely. Otherwise, the risks you're running are way too great. So, what happened was, and let me try to give you a little history. Maybe, I don't know, 50 years ago or so, or longer, there was a therapy called Prolotherapy. Okay. And it's still being used today. It was an injection treatment used to treat pain. What happens is you would inject a small irritant. You'd be using calcium gluconate or a little dextrose, which is basically sugar solution, to cause an irritation to, let's, for example, use a torn disc in your knee. Okay. So in that tear, They would use guided ultrasound because with prolotherapy, you have to be a Marine sniper. You have to be right on the money. You can't be any distance away. Any distance away is too far away. An eighth of an inch is a mile away. But if you're right on the spot, you created an inflammation. And in this inflammation, they brought stem cells into that area, and that's what did the healing. But it would take multiple injections because you had to go slowly along the entire way, multiple injections to close the tear in the joint. Or in a muscle, tendon, or ligament. That's where Prolozone therapy became so valuable. So what first happened is they first started using it on discs in the back, okay? They would use it on discs in your back. And this was done in Europe predominantly, and they found amazing results on bulging disc or compressed discs in reducing the inflammation and allowing the disc to heal. So a study was then done when this was discovered by a group actually in Canada, and back around the late 90s, I believe, they published a study showing how it helps with these bulging and inflamed discs in your back. Then it started to be used just over the year 2000 here in the USA, best that we can tell, and around the world for that matter, as far as we can tell, on joint injuries. It could be used after surgery, for example. One study showed that after arthroscopic surgery on a knee, if you inject the ozone into the joint, it can improve the outcome of the surgery, reduce pain, and overall improve the quality of the surgery itself. The conclusion of all these studies, one study showed a 5 and 10-year follow-up on the discs that I told you, the herniated discs in the spine. And the conclusion was ozone is safe and effective in approximately 75% of the patients with disc herniation, and the benefit is maintained through 10 years. So even though you're only doing a few treatments back then, now we know to do it until things have been shown on MRIs or CAT scans to be completely healed. Even just a few injections done way back when it first began showed amazing results. Amazingly beneficial for low back pain. Now, when you inject it into a joint like a knee, one of the beautiful things about it is that the gas spreads out throughout the entire knee. So not only can you, with one injection, start up a stem cell repair process on the entire tear, for example, in a disc, in a meniscus in a knee. Excuse me, I think I was using disc for meniscus. But you can also repair the ligaments inside the knee joint if they can be repaired non-surgically. Each week you do one treatment. Basically speaking, you just do one treatment. And it's not really painful. We'll get into that when we come back from our next break. And then you start out, you're at 10. Now, the following week you come back. We look to see if there's improvement. Doesn't matter how much, but we look to see if there is improvement. Maybe you went down to a 9.5. Ideally, we get you to 0. Or maybe you're at a 9 or an 8 or a 7. Wow, that's wonderful. That meant you had 10, 20, 30% improvement. Sometimes even one treatment is enough to get 100% improvement. It depends on how active your stem cells are. Remember, we're using your own natural stem cells. Stem cell therapy is often used by harvesting them from your body. They can be harvested from fat which generally shows a very weak or poor result, or from your bone marrow, which shows a much better result. Sometimes, and in many cases, they use umbilical stem cells that they take from the umbilical blood from the placentas of newborn babies. Sounds kind of wild, but that's where they come from. Again, there's risks and pain involved with harvesting them from your body, and there's definitely some risks for infection when you use the umbilical stem cells. Very expensive therapy. It costs thousands and thousands of dollars here in the US, 4, 5, 6,000, maybe even more per injection. Per injection. Prolozone therapy is very inexpensive. Certainly in our office, nobody beats our fees. We have the lowest fees for it in that we know of in all of North America, possibly the world, but certainly in all of North America. Most everybody that charges way, way more than we do, because we try to make it affordable for people, not just the wealthy. But before we go into more about it and possible outcomes, let's go to our last commercial break. When we come back, we're going to get into more. We're going to get into a little bit more about it and summarize and tell you how you can get it. Everybody stay with us. We'll be right back. So yes, this is a safe therapy. And basically, it's minimally invasive. And that's what makes it so wonderful. It's safe and minimally invasive. And you don't need guided ultrasound for it to do it if you've been well trained. That's one of the most wonderful things about it. If you've been well trained in this, and remember, this is very important, very important to help with all this. I'm learning as we do this with PowerPoint, with the PowerPoint on screen and with Zoom, how I can launch my sideshow and give you a better presentation. I'm not going to do that for this show. I don't want to mess things up. I'm going to try and play with it afterwards and then see where I can go with it. I have to learn these techie things so I can give everybody a more a professional presentation, because I have a lot of PowerPoints when I train doctors literally from around the world. It's a 3-day training. It's very intense. The first day is just spent solely on the computer.
All right, coming back in about 10 seconds.
And very, very intense. By the end of the 7 or 8 hours of computer work, their minds are fried. I have to send them back to their hotels just to recover. All right, we're coming back now to the show.
You are tuned in to Functional Medicine with Dr. Robbins.
So we're talking about Prolozone therapy. And before I go on, let me just say, what are the risks involved? Well, one, it's impossible to get an infection. It's rare that anything is 100%. I always like to say nothing is 100%, but in this case, it's 100%. When done by medically trained professionals, healthcare professionals, it should be impossible. Why? Because ozone, the gas, kills every virus, fungus, yeast, mold, and all bacteria. So unlike prolotherapy, which doesn't use ozone, and stem cell therapy, which doesn't use ozone when it's used directly, there is a risk for infection. And I've seen that with stem cell therapy myself, where a knee needed to go on to be replaced because of, well, it was going to be replaced if the stem cell therapy didn't work. And that's what stopped me from using stem cells directly. I don't like to take risks. I take Dr. Do No Harm very seriously. So what are the risks involved with prolozone? Well, you might get some discomfort and from pressure. It's possible to have some pain during the treatment. Generally, it's just uncomfortable. And I've had my shoulder, my L4-5 vertebra, my SI joints, my sacroiliac joints, my prostate, my knees, all done. And I can tell you, I never felt pain. I felt discomfort. That's all, at most, just discomfort, sometimes just from the needle stick. A pressure, that's very commonly felt, just pressure, not a painful thing, just pressure. Sometimes it hurts to have the treatment, but I've rarely ever seen that. Now, what happens after? Remember, the ozone's only in 10 minutes and it's used up. And I tell patients, don't go out and start playing ball again. Don't go out to the golf course or tennis courts and start hitting again. You're an injured athlete, perhaps. You want to take it easy and allow for repair. Remember, professional athletes, that is, when they get injured, they don't return the next day to keep playing. They rehab the injury. Once their injury is fully rehabilitated, that's when they get back to things. The key is, who cares if you play with your friends this week or not? It's the long term that matters. You want to be able to play with your friends over the next 10, 20 years or more. So let your joints, muscles, tendons, and ligaments heal. Let your back heal. Now, when you're dealing with backs, I often press the patients to go see chiropractors or osteopaths. You want to get adjustments. You have to, if you're in proper alignment, you will heal faster. And it's very important for the back to be, when you have back injuries, anywhere along the back, to have your spine in proper alignment. And that's why it's very important that you get yourself adjusted by a chiropractor. Now, I'll give you a worst case scenario. So my friend Peter Peter was a big, heavy guy, bone on bone in his knees for 10 years in pain. And he's up and down in his work every day, constantly, just constant pain. And he just tolerated it. He had no choice. He had to make a living. So we gave him Prolozone therapy, finally convinced him. It's worse with your friends and family, trust me, to convince them to do things. And strangers, it's much easier to treat. Well, finally I got Pete in and I said, let me shoot both his knees. The next day we spoke in the morning and I said, Pete, when you came in, you were a 10 in pain. What are you now? Next morning. He goes, well, if I was a 10, I became a 20 last night. Well, Pete, did you ice it? No. Did you take, arnica or Tylenol for the pain? Because you don't want to take an anti-inflammatory. We want inflammation. That's what's bringing the stem cells in. But this is a natural inflammation that's causing natural healing to take place. And his answer was no, because Pete doesn't do that. But he told me, Howard, I woke up this morning, I was a 3. I haven't been a 3 in 10 years. That meant with one injection in each knee, we had a 70% improvement in pain and discomfort. Well, what we found is by the 3rd treatment, sometimes the 4th, by the 3rd treatment, if you don't notice any benefits, it's likely not going to work. That's presuming it was done correctly by a trained healthcare professional. My buddy Robert Rowan out in Santa Rosa, California, was my teacher, my professor in Prolozone Therapy. And I always go out to California when he does his group trainings and I help with them, as well as being the guinea pig for the injections that I told you. And then I show them how to do foot and ankle injections. Of course, nobody beats me with those. I am really good at it. For plantar fasciitis, ankle sprains, ankle injuries, for all sorts of bursitis and whatnot in the foot and ankle. In any case, he teaches and trains healthcare professionals in it. as I say, I help and assist in it, even though it's so simple seemingly. You really need to know what you're doing and how to do it right. So it's been proven safe and minimally and very amazingly effective for intradisc problems, particularly in the lumbar region, which is where I work, L4, 5, and S1 and 2. I have shoulders, amazing results on shoulders. You're not going to see the video here, but I do have a woman here talking about how this has helped her shoulder. So she's telling how in just 5 treatments, her shoulder went from I could hardly lift it to full range of motion. Here's a woman who we treated for knee and for hip problems. And in this video that I have, she tells how she went from a 10 down to a 2 and almost a 0, and how this just was an amazing therapy in helping her get over her knee and hip pain, which she's been living with for many years, a prison guard, and how she was able to overcome this after suffering for so long. So, yes, you can have pain. You can take a painkiller like arnica gel or cream you can put on an area that's was injected with it, or you can use Tylenol. You just don't want to take an anti-inflammatory like ibuprofen or any of the other painkillers that act as anti-inflammatories like aspirin, or other anti-inflammatory nutraceuticals like oil of wild oregano or cat's claw. The reason for that is we want this natural inflammation to come in the next day and actually do the healing. And that's what's most important and most valuable about it. Okay, that your own body does the healing in Prolozone therapy. I've seen shoulders that sometimes they can't repair them with surgery, get full range of motion in just 1 or 2 treatments. Amazing results. My buddy Dr. Rowan has on his YouTube site many videos of people who'll tell you and show you how great they and how successful they were with Prolozone for every part of their body. I'm just starting to put those kinds of things up on the YouTube site because I want people to see and know about them. Again, if by the 3rd or 4th treatment you don't notice benefits, it's probably not going to work. Live with it or get surgery. Now, sometimes we reach what I call plateaus. You went from a 10 to a 7 to a 6 to a 5 to a 4 to a 2, a 3, and then the next week you come in, did it improve? No. Then you try one more, did it improve? No. I call that a plateau. When you reach a plateau, that's it. This is as good as it's going to get. You can't always make things 100% again because some injuries and some problems are so seriously damaged, the body can't repair it any farther than that. But to be honest, I've always seen some, if not amazing improvement in every single patient. In every single patient I had one woman with a hip. She had pain, 80 years old, pain in her left hip for 29 years. I gave her 1 treatment. Comes back the next week. So how'd you do? Well, I have to tell you, Dr. Robbins, when I left the office, I was without pain. I haven't been in pain since. I said, so why didn't you cancel your appointment? She says, I was afraid not to get another. So we gave her another treatment and we sent her home. That is not an uncommon story. Pain for years and years and years, and we get rid of it. It's seemingly in no time whatsoever. If you want to learn more about this, you can go online and look up Prolozone Therapy. If you want to get the treatments, you can call my office in Manhattan. Call my office in Manhattan. And if you have questions, they'll put you on to me. We can talk personally about it. But the office in Manhattan is 212-581-0101. If you're calling from out of country, it's a +1 country code, and then it's 212-581-0101. You can email me at ozone doctor, OZONEDOCTOR @yahoo.com. Ozone doctor @yahoo.com. Also, remember, you want to help yourself in the repair. Go to doctorsbiome.com. doctorsbiome.com. Remember to put the code radio20 in. Also, go to PromoLife, so you can do, if you can't get anywhere else, and in the world, their machines can be shipped around the world, and they work on any current because of the way they have them structured. So their machines are universally used, and you call them at 888-742-3404. That's also a +1 country code. 888-742-3404. Tell them you want to get set up for home care. And you heard about them here on the Dr. Robbins Show, so they'll give you a special discount. Everybody, stay safe, stay healthy, stay well, and come back next week to Functional Medicine with Dr. Robbins. I'm sure you'll be very happy to have been here. Bye-bye now. Tell your friends about it.